Hi everyone, it's Corey Jones with Remax Sarnia Realty, Home Team Advantage, and proud sponsors of LoveSarniaLambton.ca. I'm here at Bluewater cosMEDIC Bar with the owners Marcel, Blais, and Don Lake. Welcome, gentlemen. I guess welcome to me because I'm in your space. So we're actually in one of their treatment rooms right now. Just wanted to give you guys an opportunity to get to know a little bit about the services that they offer here, get to know these two gentlemen a little bit better as well. And so again, thanks for joining me, guys. So let me ask, when did you start Bluewater cosMEDIC Bar?
So Bluewater cosMEDIC Bar started in 2020.
Okay.
My wife started Renew Laser Aesthetics, and she was doing strictly laser hair removal.
Okay.
And we brought Bluewater cosMEDIC Bar on, and we were strictly just doing Botox and Dysport fillers.
Okay.
And it's just kind of grown from there. We've added many other services that I'm sure we'll talk about tonight. And then,
awesome.
In just about a year ago, we added Dawn as a partner because
Excellent.
we had just grown to the point where we couldn't handle it on our own, and Dawn's been in healthcare forever, and we've known each other for a long time, so it was a perfect fit.
Excellent, excellent. And a lot of people who are watching obviously probably know yourself, Marcel, because you've been a nurse practitioner in this area for several years now, right? I remember actually when you became a nurse practitioner, and Dawn, you're a nurse practitioner as well.
Yes, I am.
Wonderful, wonderful. So what made you guys decide to get into this industry? What made you think, hey, you know what, this is what we want to do? Is it beneficial because of your background to be able to do these services? Like, does it help with what you're doing, or?
So for myself, I worked 20 years ago in a plastic surgeon's office doing post-operative care and stuff in the operating room.
Right.
And just that whole cosmetic type thing was interesting.
Okay.
And to be honest with you, one of the reasons why I like it so much is it is completely and utterly different from what I do on a regular daily basis.
Right, right.
Not different in a better or worse way. It's just different. So people are here because they want to be here. People aren't seeking my care because they're sick and they're injured and they need, help from that.
Right.
They're here because they want to be, and it's low stress. It's very fun, and the outcome is awesome.
Yeah.
So that's I wanted to do it because it was something I was interested in, but it's totally different from any other kind of medical world.
For sure.
And I think it's kind of a neat field to be in too, because like what Marcel said, these people are coming. You see them leaving with a smile on their face.
Right. Yeah.
Other than I work for cardiac surgery, so people are coming with heart attacks or whatever, and leaving feeling better. But this is different.
Absolutely.
They're coming in healthy and leaving again with a smile on their
Absolutely. Absolutely. Taking care of people, not only their physical, but their emotional.
Exactly.
Right. So you're helping them build their self-esteem and helping them feel better about themselves. That's awesome.
Yeah.
That's awesome. So it's not necessary in this industry necessarily to have somebody with a medical background, but are there some services that it's important to have, like that you provide? That
actually, in order to do the injections, you do have to have a license.
Oh, you do.
You have
okay.
to either be a physician, a nurse practitioner, a registered nurse, or a registered practical nurse, because you have to have a license to do a procedure underneath the dermis, right?
Gotcha.
With an injectable. So
gotcha.
That you do have to have that to begin. And then, I mean, it is a very niche industry, so there is a lot of training that goes into it. There's a ton of technique. It isn't just taking a product and injecting. There is an art to it, and it is very complex. So every single service we have has a different training, a different set of, I guess, what's the word I'm looking for? Just a different way of approaching it and a different skill and knowledge level that you need.
You really have to understand the anatomy of the face,
right?
And what muscle does what,
right?
And where you're injecting these products,
for sure,
to manipulate those muscles to do what you want to do.
Okay, basically. Awesome. Can you tell us a little bit about some of the services? So, you're talking about injections, things like that. But for those of us who don't know necessarily what those are, what type of services do you offer here?
Sure. So we offer Dysport and Botox, which are neuromodulators, and that's for wrinkles and stuff. So that's the mainstream when you hear the word Botox.
Yep.
Botox is a phrase that is from a company called Allergan, and they developed Botox, and they have that name.
So it's their own product. Okay.
Their own product.
Yep.
And then other companies such as Galderma has come out with Dysport, and they're the same in essence product. They're just manufactured a bit differently. Maybe the molecule is a little different, but at the end of the day, it's all about, the neuromodulator and getting rid of the wrinkles and those types of things, right? Now, Dysport and Botox can also be used for non-cosmetic type things.
Right.
We use them medically here at the clinic for migraine treatments, hyperhidrosis or excessive sweating.
Oh, really? Okay.
For the hands. Torticollis, which is tightening of the neck.
Okay.
TMJ, so really tight jaw muscles.
I've heard that.
So we do a lot of medical injecting here as well.
Okay.
We do a full consultation and we do those kinds of things with that.
Excellent.
Plus, we do follow-ups with the patients as well.
So then we also offer fillers.
Okay. Yeah.
So fillers are a little bit more. Well, go ahead. Yeah.
The fillers are hyaluronic acid.
Okay.
Which was a natural product that's in our underneath our skin.
Okay.
And as we get older, our hyaluronic acid kind of degenerates a little bit, and that's what causes some of the sagging in the face.
Okay.
So with these filler products, all the filler products we use here are hyaluronic acid.
Okay.
And it just kind of, it's like I said, it's a natural product that's underneath our skin.
Okay.
And it's what we call hydrophilic, which helps absorb water and helps expand and gives you some volume in your face.
Interesting. So how long would a treatment like that normally last? So if somebody had a treatment of like a filler.
Fillers?
Yeah.
So the fillers usually last about 9 months is what they say, up to 9 months
to a year. Okay.
So,
okay. Excellent. Yeah. And what's the approximate cost of something like that? Does it vary depending on how much is required, or is it? Yeah.
Yes. Yeah.
Okay.
So we use the Restylane product here from Galderma, and for one syringe is $500, and for a half of a syringe is $275.
Okay.
And it depends on the person. We do a full consultation with all of our clients, and we kind of decide with them what's best.
Okay, something I didn't actually kind of prepare you for. How long does a treatment like that take? Like if you're somebody who's to have something like that,
usually about an hour, depending on how many vials they want or where they're wanting the injections. But a typical injection lasts about an hour.
Okay.
Because the full consultation through to the end of the procedure. Yeah.
Right.
Now for the Botox and Dysport, it lasts anywhere from 3 to 5 months.
Okay.
It depends on the person.
Yeah.
And as the movement starts to come back and the wrinkles start to show back up, then people will come. And it all depends on the person. Some people like to come right at 3 months.
Yep.
Others will kind of push it out to 4 or 5 months. And
sure.
some people, just come a couple of times, a year type
yep.
of thing. But different for everybody. And our cost for Dysport or Botox is $7 a unit. And,
okay.
And there's that's what we do across the board.
Okay. Well, that sounds reasonable. I don't know, but it sounds good. And so you say it lasts about 5 months. And how long does a treatment like that take? Same? Is it?
No. So Botox is usually much quicker.
Okay.
And it's because there's a real art to doing fillers.
Okay.
And I'm not saying that there isn't with Botox, but
right.
Botox is, you're putting it in and you're looking at specific areas, and
right.
and it's more about the amount as opposed to kind of the art of it.
Gotcha.
So that would take from start to finish with a consultation 15 to 30 minutes.
Okay. Well, so that's pretty reasonable then.
Yeah.
That's awesome. So now I know that technically I actually did a little bit of research just because again I'm not familiar with a lot of the services you do. This is au naturel. But I know that Botox isn't technically addictive, but I've heard that people do kind of get addicted to these type of services. Do you find that? Do you find that people are, they just come in and they need to have it, or it's like a regular thing for them? Or
people are pretty reasonable. They don't have unreal expectations. The most patients or clients we have that come in here.
Yeah.
And I think it's important when you're starting a relationship with a client is really setting that expectation.
Right.
Because people may have thoughts of grandeur of exactly what they're looking for, and you have to make sure that the expectation is going to be realistic. Right?
Okay.
But the nice thing, in my opinion, is cosmetics, not just Botox, fillers, everything has become very mainstream, and it's not faux pas anymore. I guess
right. Yep. Yep.
So everybody is looking into it, and I do find some people will come specifically because they're looking just for Dysport.
Right.
And then, tell me about the fillers, or tell me about the hydrofacial.
Gotcha.
Or tell me about the microneedling, right?
Yep.
So then they kind of ask about more, and then we kind of build off of whatever they're looking for.
Okay. Is there a risk in having it done too often? If somebody was to, I guess if somebody had a area that they wanted to work on, if they had some filler done or had some Botox done or something, is there a certain length of time that they have to wait before they can do it again, or can they come as often as they like? Or
you do want to try and wait at least 3 months, especially for the Botox and the Dysport. Now, I mean, it's not like, you know, there are definitely risks, but putting more in is just going to, you know, stop the movement of that area even more, right?
Gotcha.
Right?
Gotcha. Okay.
Yeah.
Okay. So most people have done their research and they probably know not to come in and do it too often. So excellent.
And we try to be very diligent about, you know, not injecting people too early or, you know, and kind of reorienting them to the time frames and things like that.
Right.
So,
Yeah.
Our whole focus is really about regular individuals treating regular people.
Love
right?
that. Yeah.
We have a very conservative injecting style. So the philosophy that we have is we would rather put more in because once it's in, we can't take it out.
Right.
So I would rather give a conservative treatment, and same with Dawn.
Yes.
And we would. So our policy is we inject, especially for Botox and Dysport, it can take up to 14 days for full effect.
Oh, wow. Okay.
We reach out to every single one of our patients on day 7.
Awesome.
We reach out again on day 14, and if they think they want more, they can send us pictures. We can bring them back in. We can do a little bit more, and then that's just that kind of rapport that we have, and we make sure that we do that with every single patient.
That's awesome. That's awesome. So everybody gets reach out. You reach out to them.
Yes.
That's super cool. So I did see on your Facebook page you guys do, and you mentioned a couple times microneedling. What is microneedling?
So microneedling is basically producing collagen production with using sterilized needles.
Okay.
And it's basically to treat scarring, acne, wrinkles.
Okay.
So we actually use a device that has 5 surgical blades, and we make controlled holes and damage that just goes like a very minute amount into the skin.
Okay.
And we replace those openings with 100% hyaluronic acid, which then builds collagen and helps smooth, and it brings plumpness and that kind of stuff. So
awesome.
The microneedling is amazing from that standpoint because, like Don said, it can help with fine wrinkles, smooth the skin, it can get rid of sunspots, and it's kind of that all-over treatment that you can do, and it goes very well in conjunction with Botox fillers and some of the other services that we offer here.
Gotcha. Now, is it a painful treatment? Is it?
We do use numbing cream on the face, so it can be a little bit painful, but with the numbing cream that we have, it's very tolerable.
Okay.
And we've had lots of patients. It's interesting. Some patients have explained it as it feels like somebody's taking a bit of sandpaper and just rubbing it on the face.
Okay.
Another lady said that it felt like her cat's tongue with that. Really
is that right? So just a little rough.
So
okay.
Just a little rough. So it definitely is not, super painful. We have some people who will be very upfront and say, I have absolutely no pain tolerance, and they tolerate it very easily.
Is that right? Okay. And what's the recovery time? Like after they've had something like that done, how long does it normally take to kind of, because I imagine it probably creates some redness initially, and so how long does it normally take?
Sunburn.
Yeah, okay. So we always tell people you need at least 24, but we recommend 48 hours of downtime, and that downtime includes not putting makeup on, trying not to touch your face, because we're actually increasing the absorption of your skin by up to 200 to 300%.
Okay.
So because we really want that hyaluronic acid to soak in, we send you home with more so that you can put it on a couple times. Okay. You go home with a mask and those kinds of things. So you will leave here looking like you spent the whole day in the sun.
Okay.
So we always give people that caveat that, do it when you've got a couple of days of downtime.
Right.
And that hyaluronic acid is the same kind of material that's in the product that's in the fillers.
Okay,
so
right,
hyaluronic acid that produces it, hydrophilic, absorbs water.
Gotcha.
Like he said.
Gotcha. Now, so does that, when they have a microneedling done, are they more sensitive to being in the sun afterwards, or is it not really?
So
they are.
You want to try and stay out of the sun too.
Okay.
Yeah, because like I said, we've done controlled damage to your tissue and your pores, and so.
Okay. Similar to a tattoo, kind of, right?
Right.
So absolutely. So and I didn't prepare you for this either, but I have to ask. I don't know yourself, Don, but I've known Marcel for a long time, and his lovely wife Julie. Is that how you guys look as good as you do? Are you guys doing microneedling for yourselves too? Is that because Marcel looks the same as he did when he was in his 20s, and Julie's probably 18. So So anyway, but
I'm living off love.
Living off love. Okay, that's fair. Yeah, that's fair.
No, but all joking aside, we do take advantage of our services.
For sure.
So
Yes, absolutely.
on top of the Botox fillers and the microneedling, we offer hydrofacials here, which is hydrofacial is an actual company, and their machine uses high pressure water and suction.
Yeah.
And what it does is it opens up the pores, removes all of the they have an actual product called the gumki that shows the pores and everything at the end.
Yeah.
But it removes all the toxins, and then again you're replacing it with moisturizers and hyaluronic acid to kind of smooth. So we have both done hydrofacial treatments.
Awesome.
And we've added another service where we do IV hydration.
That was my next question. I actually was reading about that, and I spoke to somebody today that did one for their immune system. Okay, so talk to me about these IV treatments. What what are they all about?
So they're amazing. So we actually use a company out of BC, and they're called Farsk, and they have a combination where they mix everything in their sterile environment under the hoods, and then it comes to us frozen, and we keep them that way until we use them.
Okay.
And there's an array from energy to immunity to radiance and
like for skin health.
Oh, really?
Yeah.
Okay.
There's NAD plus, which is a lot of the aminoglycosides, and so I mean the benefits are pretty understanding. You know, you've got good quality B vitamins, vitamin C, vitamin E. The immunity has lots of zinc and magnesium. And, I mean, you're getting 500
vitamin C, IV.
You're getting 500 mils of fluid, at the same time.
Yeah.
And I mean, you're getting vitamins and nutrients right into your veins, right? And I mean, I can speak for myself. I'm quite busy. I have a full-time job as well as the business and kids and everything. And I have been doing an IV therapy once every 2 months.
Okay.
You can do them as many as every 2 weeks.
Okay, I was going to ask that,
And I've been going back and forth. I've done the energy, the immunity, I've done the radiance and the NAD. And for me, it takes away that mid-afternoon dump, right?
Yeah.
So where I just have no energy and I feel like I need a nap.
Right.
I'm waking up in the morning with less issues. And I just find overall it's making a huge difference for me just in my everyday life. And it has been wildly popular.
Okay.
It is one of those services that we added because we had an interest in it.
Right.
And we felt that there was a need.
Okay.
And I can't believe the response we've had.
Is that right?
So many people. The IV therapy has definitely exploded since we brought it on board.
And
I've also done the IV therapy.
Have you? Yeah.
Unbelievable.
Yeah, really.
Results.
And you've done both the energy and the immune system as well?
Immunity and
You did the build?
Build. Build.
Okay.
So some of them really focus on like liver detoxification, cell reproduction, and that kind of stuff.
Yeah.
So we do a full consult with people. We talk about what it is that they need. We do a full health assessment too, because we are putting fluid into your IV and into your veins, so we make sure but we do a full consultation and then we come up with a plan that works for them, and it's been very well received.
Very cool. Do you mind me asking the approximate cost of an IV treatment? Is it a very expensive thing, or is it?
Depends on what IV you get.
Okay.
But,
I think they're anywhere from $125 to maybe $250 to $275.
Okay.
So it all depends on what's in them and what you use, and then from start to finish, it's anywhere from 45 minutes to an hour and a half.
Okay.
Because it depends on the fluid you're putting in and how fast and those types of things.
Right. So just come in here and they lay down in one of the treatment rooms and just relax.
We've got a reclining chair in the back,
Yep.
and you sit and put your feet up. We've got some music on. We dim the lights, and you just chill.
Just chill.
Yeah.
Very cool. Very cool. So, you say that's becoming increasingly popular.
Oh, yeah. Quite a few of those.
Have a lot of people heard of it before they come in, or are they seeing it just with you advertising? Because I've never heard of it.
Just
but
by advertising and word of mouth, and
really?
one person will come in and then they'll tell their friend about it.
Yeah.
They'll get a call from their friend, and so it's been pretty popular just by even word of mouth and Facebook.
And some people will come in and say, "Oh, I've done it before. In Florida or when I was on vacation."
Right.
Some people's benefits cover it.
Is that right?
So people can come in and they can do the service, and because they're trying to promote health and that kind of stuff. So,
That's awesome. And do they get billed direct through their benefits, or they pay for it and they get reimbursed? Or
they would just pay for it.
And get reimbursed. Okay, excellent. That's super interesting. So very cool. Now, are there any age restrictions on the services you guys offer? Like if somebody wanted to have an IV treatment, or if somebody wanted their kids to have it, is that a thing, or do they have to be a adult? Or?
So our rule of thumb is 18 and older.
Okay. Yeah.
Now, having said that, there are some things that we can do. We have lots of our treatments that are really good for acne.
Okay. Yeah.
Whether it's a hydrofacial, whether it's microneedling, whether we do an LED light therapy.
Okay.
We have the laser that can treat some things, right? So
wow.
As long as we have the consent of the parent and the parent's on board and the child knows exactly what's going on, we can do that. Now, I mean, when it comes to things like Botox and Dysport, some kids will get the treatment for hyperhidrosis, right?
Okay, yeah.
Somebody under the age of 18 maybe have excessive sweating. We've done that, but again, in consultation with the patient and with the child. But I mean, if a 16-year-old came in and said that they wanted Botox and filler, that's just
right.
That's just not something.
Right. Now, if they're, like you say, if there was consent, if they had like TMJ or something like that, then obviously
that'd be different. Consent for that.
Okay. Yeah. Now, one of the things, obviously, this industry is becoming more and more popular. Like you say, you mentioned earlier in the conversation that it used to be kind of a little bit not taboo, but it was kind of. Why do you think it's becoming so much more popular now? What's happened? Is it more in the media? Is it more?
There's more advertisement with it. It's a little bit more open.
I think celebrities, you got to give it to the celebrities are coming out and they're admitting the fact that they do Botox, fillers, and they do procedures and those types of things, and it's just become more mainstream, and I think people are upfront and comfortable with saying, hey, I go and I have this done, and it's okay.
Right? And it's true. And being a realtor, obviously, we, I'm sure you probably have lots of realtors that come in here, but I've heard that more times in this industry than I have in any other industry.
The athletes and the IV infusion.
Yeah. Oh, I'm sure, right? Because it's going to give them more energy for the.
And you talk about profession. We have lawyers and teachers and others who come in because they say, I wear every ounce of my emotion on my face because of just it looks like I'm growling and it looks like so they want that so that they can kind of have a little bit more control over that. So we have lots of different professions that come in and say I want this for that as well.
That's awesome. That's awesome. Very cool, guys. Okay, time to get a little bit personal. So I know Marcel, but are you both born and raised Sarnia, or?
I was actually born in Windsor, but grew up in Sarnia.
Okay. When did you move here? How old were you?
I was 3 years old when I moved.
Okay, so you're Sarnia guy. Yeah.
Went to Clark School. And, And a lot of people probably don't know what Clark is.
My dad taught there actually, so yeah. So
and then I went to Northern and graduated from Northern.
Very cool.
And went to Lambton College first, and then went to St. Clair College in Thames campus.
Yep.
In Chatham, and then graduated from Western.
Awesome. And how about yourself, Marcel? Were you
born and raised?
Petrolia boy. Yeah.
Against me.
No, not at all. Not at all.
And then moved to Sarnia after he got married.
Yep.
And I've been here ever since. And,
awesome.
I worked in Port Huron for about 6 years.
Yep.
But have lived in Sarnia my whole life.
Awesome. Yeah, it's a great city. Marcel knows, you maybe don't. We've actually left a few times and come back. We're here to stay now, but it has a way of calling you back, right? So now, if somebody was looking to make a move to Sarnia, how would you describe Sarnia to them? Like,
beautiful Bluewater.
Yeah.
You have Lake Huron, the river.
It's a border city. The summers are amazing.
A lot of entertainment here.
Great pizza.
Great
the winters have been. Breweries. I just think a lot of my family lives in Quebec.
Right, I knew that.
They come down once a year.
Yeah.
And every time they come, they want to go to the water.
Is that right? Yeah.
And every time we do that, I realize how much we take it for granted. I mean, we live 5 minutes from 100%. Beautiful water. And we maybe go twice, 3 times a year.
Absolutely. And this, like you say, the winter is amazing. This year, I've actually still been kayaking once a week. So I'm going out this week too because I'm not ready to give it up. Absolutely. No. Now you guys work a lot, right? Between here and the clinics, things like that. What do you do in your spare time? What do you like to do?
I love to
Do you remember spare time, Marcel?
I love to travel.
Okay, yeah.
I love to travel.
I mean,
they travel with us once in a
we
while.
like to travel.
Yeah.
We have kids who are in different sports. My son goes to University of Windsor,
Right.
plays football there, so we were down in Windsor almost every weekend.
Awesome.
For that. I love to go out and enjoy some of the places in town.
Yeah.
My favorite place to go in town is the Imperial City Brew House.
Yeah.
Shout out to Imperial City.
There you go. Yeah, absolutely.
Love it there, and and just kind of relax and enjoy the area. But
we also have, I should mention this, we also have season tickets to the Sarnia Sting.
Oh, awesome.
So I'm
Awesome.
actually missing the game tonight.
Oh, no. Oh, no. Well, we'll get you out of here as quick as we can. So that's awesome. So very cool. And so this question is more for Marcel, and I'll get to you in a second,
Yeah.
Don. I'm not sure if you're a fan, but our Lions. Hey, like our whole lives, my friend. Every year, this is the year. This is the year.
You know what? This is the only year I've ever had to worry about the playoffs, because usually by this time we're worrying about the draft.
That's right. Exactly. But for fellow fans, this is the year, I think, for real. So how far do you think we're going?
Well, we got to, if we can go 3 out of 5.
Yeah.
In the next, we'll have a home playoff game.
Yeah.
If we can make it to the second round.
Yeah.
It will be one happy.
Absolutely. And Julie is probably equally as excited.
You have no idea how excited
I'm sure she's very excited. Absolutely.
Yes.
Absolutely. So listen, guys, supporting local. I mean, you guys are local business, obviously. Supporting local is so important. Besides Imperial City Brew House, any businesses that you kind of find yourself frequenting more than others? Anything you
Actually, the 4 of us and Don's daughter just went out to Boulevards last night for dinner.
Yeah.
Awesome place.
Yeah.
I find the food to be fantastic. It's very consistent. The service is always amazing.
Absolutely.
So we love going there. We actually really enjoy going to Legacy as well.
Yep.
We find the food there to be fantastic. And, we, in the summertime, we love to go to Stone Picker. We go to Point Brewery.
Nice.
Refined Fool, Imperial. I'm a big craft beer guy. I love it.
Yeah.
Lola's.
So
very cool.
Dressy's Pizza.
Oh, of course, since 1975. So yeah, there you go. So very. I mean, we didn't talk about this, but just in hearing you guys talk, obviously you guys are more than just business partners. You're friends too, right?
Oh,
yeah,
absolutely.
that's awesome. That's it. I'm sure it's felt with your people who come in here. Like they can tell you guys just more of a family environment than a
We've been
cold.
buddies since 2008.
Okay.
And like you said, we travel together all the time. We do things together, and then like you said, Julie is here. It's great working with my wife, and then his wife is she's a nurse anesthetist in the States, so she'll be coming over and doing some services
she
as
gets
well.
licensed. She's trained. She just is working through her Canadian license.
Gotcha.
And because of our expansion and how busy we've been, we hired an amazing registered nurse. Her name is Priscilla O'Reilly.
Yeah, I saw that advertised. Yeah.
Absolutely amazing. And,
wonderful.
She's really been a big help and a big addition to this.
Huge.
And she's not from Sarnia, right? She came here to work with you guys, or was she? Or she from?
She's from Sarnia.
Oh, she is from Sarnia. Okay. I thought I heard she was from
Yeah,
somewhere
no,
else.
she's born and raised, and, and she brought some really neat things too, because she was in the industry, but wanted to kind of get part of a bigger team, and she's added lip blushing, which is like a semi-permanent makeup to the lips.
Okay.
And it lasts about 2 to 3 years, and that again is another service that has really gotten a lot of interest.
I guess it would. Yeah, 2 to 3 years. I mean, that's and what's an approximate cost of a service like that? Do you know off the top of your head?
Around $450.
Yeah, I think it's about $450
for a couple of years.
It takes about 2 hours for
Okay.
the procedure.
Okay.
Again, we use the numbing cream, and it's kind of like tattooing your lips.
Okay.
I mean, it's been very, very.
There you go. Well, I'm a tattoo guy. Might be my next. Yeah, you never know. Yeah, absolutely.
She's also going to be adding the powdered eyebrows.
Yeah.
Powdered eyebrows. Okay, and what's a powdered eyebrow?
So it's very similar to the lip blushing, except on the eyebrows.
Okay, so very cool.
Yeah, semi-permanent. Yeah.
Very cool. Well, listen, guys, you know what? It's been a pleasure getting to know a little bit more about the industry, and obviously getting to sit down and chat with you. It's been a real eye opener for me because I don't know about any of these things.
Sure.
But in kind of gearing up to this, I did a lot of research on and I've kind of been following since you started, because I like to see you guys doing well, obviously. But I really do appreciate you taking the time to meet with me today. If somebody's looking for you, looking for information on your services, where can they find you guys? On socials, website, or what's the?
So we're on Facebook and Instagram.
Okay.
We actually are in the process of revamping our website. So
Okay.
It's been down, but it's going to be back up probably maybe the new year at the latest.
Yeah.
And once that comes out, we'll really put that out there for people. And then, but like majority, it's the easiest to find us, just Bluewater Cosmetic Bar on Facebook and Instagram.
Okay.
It has links to everything. We've got all the contact information there.
Excellent. People can reach out to you through your Facebook and Instagram page as
yeah,
well?
Absolutely.
Yep.
Awesome.
Yeah,
Awesome.
for sure.
And probably tomorrow they're going to be able to find you on lovesarnilampton.ca as well. So there you go. So thanks for joining us, everybody. And again, gentlemen, I appreciate your time.
Yes,
if you've got any questions about real estate, you'd like to chat about this ever-changing market, give us a call. Check us out at hometeamadvantage.ca. Thanks again, everybody. Have a great night.
Awesome.